Welcome to the pharmacy. How may I help you? You do? Okay. You just picked up some prescriptions and you have some questions? All right. And what was your name? All right. I filled those earlier this morning. I'll be glad to take a look and answer any questions you may have. Okay, let me see. All right. I'll just refresh my memory as to what I filled for you. Okay. We have some ciprofloxacin is the generic, which you got. And this is an antibiotic. You must, okay, all right, you have a sinus infection. Okay. Well, this is an antibiotic, and this will help clear up the infection that you have in your sinuses. Do you have a lot of sinus pressure? Right in there? Yeah, especially when you bend over or move too quickly. All right, that's the pain from the pressure in your sinuses from the infection, and you probably have some swelling in there as well. The antibiotic will help to kill the bacteria that's causing the swelling, and it will also help with the swelling, the inflammation in your sinuses. So that is what the Cipro is for. It is a good idea to take it with food. You don't necessarily have to, but it's not a bad idea to take it with some food, maybe, a little bread or some crackers, or just, take it with a meal. And you will take these twice a day, roughly every 12 hours or so. And what a lot of people do is they will take it in the morning, like when you get up and you have your breakfast. You can take it then, and then take another one probably around dinner time, and just take it with your dinner. Okay, so that's what the Cipro is for. And okay, what's this? Okay, it looks like, right, you also have some let's see, these pills look hard. Okay, this is also for inflammation. And this one, it says here, okay, no, this is Phenergan. Have you been having nausea? No? Sometimes they will prescribe Phenergan for, they will prescribe it for nausea, but sometimes it's also prescribed to help you sleep. Have you been having trouble sleeping? Okay. Well, the Phenergan can help you sleep because one of the main side effects is drowsiness. So you would want to take this at night, and we have a sticker on here. So you take this at nighttime, and it will help you sleep. Okay. So that is why you would take this. I'm going to set the bag down for a second. I'm going to get out the items in the bottom. Okay. And you have ipratropium bromide nasal solution right here. This will help. This is a nasal spray that you will do 2 sprays in each nostril 3 times a day as needed. This will help with nasal congestion. It will not make you drowsy. It may cause a little bit of dizziness, so you may have a little trouble with a slight bit of dizziness. Just something to keep in mind, maybe if you're driving or walking, especially if you go up and down stairs. You may just want to make sure to hang on to the handrail just to be on the safe side. And it comes in a box, and I'll show you what it looks like. And you have this little spray bottle here. This blue band is to keep this part from being pushed down before you're ready to use it. And you can remove this when you're ready to use it. You just take this little blue plastic piece off, and that will allow you to push this down when you're ready to use it in your nose. And you remove this little plastic cap right here. This sort of semi-transparent plastic cap. You would want to remove this before you use it. And it has on here, you read the full package insert. There's a little folded up paper in there with additional information about this drug that you can read if you like, and it could list some other possible side effects or things to look out for when you use this. But you only need this, use this as you need to. If you're not having trouble with nasal congestion, you don't have to use it. You don't have to finish the entire bottle. It's not like the Cipro. You just use it as you need to. So I'm going to put this back in your little box here. And this is made by Bausch & Lomb, which is a company that also makes contact solution, things for your eyes. They also make ear medications, ear drops, things for the ears. But mainly they make things for the eyes. But see, they also make this nasal spray. And this is a generic that Bausch & Lomb manufactures. So it might be a good idea to keep this with you when you go to work. That way you'll have it in case you need it while you're at work. Okay. It's very effective. I think you'll be very pleased with it. It helps to clear the nasal congestion, as the Cipro has time to work on the bacterial infection. Okay. And we have one more thing in here. And this is benzonatate, which is the generic for Tessalon pearls. Do you also have chest congestion? You do? Okay. Do you have bronchitis? No? All right. Well, the chest congestion, this helps with that, and this will also make you drowsy. So you would not want to take this during the day if you're going to be driving or doing anything where drowsiness would be a problem. You might only want to take this after you get home, maybe when you're ready to go to bed. And you take 1 to 2 capsules by mouth. It says you could take it 3 times a day as needed for up to 10 days. But you only take it if you need to, if you feel that you have chest congestion that is becoming a problem. You can take this, and this will help with your chest congestion. They are interesting looking little pills. I'll show you one. They're very small. See? They're very small. They almost look like a vitamin E capsule, but they're not. It's a medication. It's not a vitamin. They're very little, and they're sort of a yellow color. And you have 30 of these in your bottle. Right here. And you want to make sure to keep all of this medication out of the reach of children, of course, because you wouldn't want a child to get into it and take your medication, because that could be pretty bad. So just make sure that no children can get to it. This has a child-proof cap on the top, which of course you push down and turn at the same time. And this helps keep small children out because they have a hard time turning it. They don't know to turn it down, push it down and turn. But you definitely want to keep all your medications out of the reach of children. And inside your little bag here, we have some information about your medication. It's just a little leaflet, and I folded it up and placed this in your bag. So if you have any additional questions, you can read over the information on the leaflet. There's some information here for each of your prescriptions, and the number for our drugstore is on the documents. It's on the leaflets. If you have any questions, please don't hesitate to call, and we will be happy to help you with any questions you may have. And of course, you can also call your doctor if you need to. If you're experiencing any troublesome or unusual symptoms, I certainly would advise you to call either our pharmacy or your doctor right away. Okay. Have you ever taken these medications before? The Cipro. Okay. Well, these other ones, the Tessalon and the Phenergan and the nasal spray, are all great medications. I think you'll have wonderful results. But of course, if you've never taken them before, if you experience any shortness of breath or fainting or any concerning symptoms, please do either give us a call or give your doctor a call right away. Okay. I'm going to place all of your items back in your bag. Okay. Did you have any more questions? Okay. Well, that's fine. If you have any trouble during the day when you're at work and you want to take something maybe for sinus congestion or pain, like if you have any, if the pain in your sinuses becomes especially troublesome, you can take Advil, which is a non-steroidal anti-inflammatory drug, which will help with the inflammation, which will of course then help with the pain. So if you have, especially up here on your forehead or right in here, right under your eyes, any pain, you can take Advil or ibuprofen, which is the generic for Advil, and it will help reduce that swelling and inflammation. Did you need some Advil? Can I help you find some? You have some. Okay, great. Another thing that I can suggest is Sudafed with Advil combined. We keep behind the counter. There is pseudoephedrine, and then there is phenylephrine. The phenylephrine you can obtain over the counter. Pseudoephedrine, now you have to come back here to us, to the pharmacy, to obtain, because people do use it for illegal purposes, and we like to keep it controlled. And I'll show you what that looks like. I have some here. And this is a generic. We of course also have it in name brand, but the generic is a little less expensive. It's the same drug, the same two drugs. It has ibuprofen and pseudoephedrine inside each tablet. They're small tablets. They're about that big, and they're brown. And you take one every six hours or so if you have trouble with that. The ibuprofen will help with the swelling, and the pseudoephedrine is a good nasal decongestant. So even if you have nasal congestion or anything, and you don't want to use the nasal spray, you can take one of these, and it is safe. It will not have any interactions with your Cipro or any of your other medications. And this package here comes with 20 coated caplets, so you have 20 doses in here. It is less expensive. This is only about $6. The brand name is about $10. So if you'd like to have this, I'd be happy to take care of that for you. You would? All right. I'm going to set that aside. I'm going to show you one more thing that we have that you can get to help with your symptoms during the day. We have these here. This is the generic of Dayquil, which is the daytime version of NyQuil. We have daytime liquid caps, and these can be taken during the day. They don't cause any drowsiness, which is why they're called daytime. And it has several different drugs in it. This is a combination of multiple medications in one caplet. It is a liquid cap. It is a gelatin capsule filled with liquid. As you can see, they're kind of a red color. It contains acetaminophen, which is the generic for Tylenol. It's good for aches and pains and fever. Have you had any fever? No? You want me to feel your forehead? Okay. Now, of course, this is just subjective, but to me, you don't feel warm at the moment. Okay, but you might want to keep, if you're concerned about a fever, you might want to keep your eye on your temperature. You might want to take your temperature occasionally, because you can't feel your own forehead until if you have a fever. So definitely, keep an eye on your temperature. It has dextromethorphan in it, which is it helps with chest congestion and coughing. It is a cough suppressant. Phenylephrine, which is the over-the-counter version of pseudoephedrine, which is Sudafed. I would not suggest taking this with the pseudoephedrine and Advil caplets that I just showed you. I would really recommend just taking one or the other. You could take this or that. This would be good to take if you had any coughing, if you've had trouble with coughing, especially if it's a dry cough. You could take this during the day and it will help calm that cough down. And as you can see here, it says it relieves your major cold and flu symptoms through your day. And it is alcohol-free and antihistamine-free. The antihistamine would be diphenhydramine, which is the generic for Benadryl. And diphenhydramine is a very common drug in nighttime or PM medications, and people also take it for allergies. One of the main side effects of diphenhydramine is that it causes drowsiness for most people. Some people don't experience drowsiness, but most people do. And that is one of the main drugs in also for, I think, Sominex for sleep is nothing but diphenhydramine. That's all it is. So you want to, would you like to take this also? Yes, it comes, there are 12 soft gels, which would be 6 doses. And this is $4.29. The brand name Dayquil is about $6.50. So would you like to take this one or the brand name? This one? Okay. Great. This does not contain pseudoephedrine, as it says here, but it does have phenylephrine, which is the over-the-counter version of pseudoephedrine, which you can obtain without going to the pharmacy. Okay. This is made by Good Neighbor Pharmacy. It is a generic brand. Comes in a nice box. Okay. Let me just pull up your profile for a moment, okay? Do you take any other medications? Okay, I'm going to pull up your profile really quick and just take a look at some of the other prescriptions that you have on file, and just to see if there are any contraindications for this or the pseudoephedrine with ibuprofen. Okay. Let's see. Let me get to the right screen. Okay. Well, your last name. All right. And your first name. Okay. And what is your date of birth? Okay. All right. Let me take a look at your other prescriptions. Okay, now it says here that you do occasionally take alprazolam, which is the generic of Xanax. Okay, how often do you take that? Okay. Okay. Do you ever take that during the day? No? All right. Well, I will say that if you take the Xanax at night, you might want to consider not taking the Tessalon pearls, the benzonatate, the little clear, they look like vitamin E. You might not want to take both the Xanax and the benzonatate at the same time because it could cause excessive drowsiness. And I also would advise you not to take the Phenergan and the Xanax at the same time because of the same problem, because Phenergan can cause drowsiness. So we definitely don't want you to get too drowsy. Okay. Would it be possible for you to not take the Xanax while you take these other medications? Okay. Of course, if you need to take the Xanax during the day, you can take a half a dose. Okay. If you do need to do that, that will probably be fine. Do you experience drowsiness when you take it? Not with the half dose. Okay. Would you mind if I made a note in your chart, in your file, about the medications, and that we spoke about this today? Thank you. Okay, great. Well, I'll ring you up for this, for these two items here, the daytime liquid capsules and the ibuprofen cold and sinus. Okay? Do you have your customer loyalty card? Okay, while you get that out, I'll ring you up for these. Okay. And that comes to $12.77. All right, let me just take your card and swipe it through. Okay, and your card, your customer loyalty card, certainly. Okay, there you go. Thank you. Let me just get your receipt, and I will have you all ready to go. Okay, it's just, all right. I have your receipt. All right, and everything is on there, and it shows that your card, your customer loyalty card was used. All right, I'll give you a receipt. Would you like a separate bag for these items? No? All right, great. Well, I'll just let you hold on to these in the receipt, and here, of course, I have your prescription bag right here with your medications in it and your prescriptions. Okay. Is there anything else I can help you with today? Okay, eye drops. Wonderful. I'll be happy to show you where those are. Those are right over here on aisle 9, and we'll just go take a look at those, okay? Great. Thank you.